Okay, here's another video for day-to-day stuff. SBAR, situation background assessment and recommendation. Pretty much universal. Basically handoff. You're giving from one nurse to another what is the highlights, what is necessary, little tricks of the trade, morning rounds maybe for social work and stuff like that, and care managers. I had a really good piece of advice for morning rounds and that aspect from a nurse, and he got it from somebody else. Was what is keeping the patient in the hospital? Why does the patient still need to be here? That should be one of the highlights, wherever, if it's multiple reasons. Whether it's IV antibiotics, procedure, lack of insurance to go to the next facility, waiting a bed, tests at another facility. It might be that, that facility's full, or they want this patient to have a double COVID test pass, or double negative, kind of a scenario. It could be, they still need to get another antibiotic dose, or maybe they need to finish their dose. Might be like a 14-day regimen or 14-dose regimen, whatever, and they're on 13 and they need one more, or et cetera, et cetera. So that's one of the main things for SBAR to get across. Follow the systems. I'm sure each facility is different. Our facility has whatever order of their body systems that we follow, and pretty much the nurses learn to follow that and expect that. And that's fine that you do that. I think one of the main things that is it's glossed over, and it's just my opinion. Again, these are all just my opinion. Is diet. It's very important to the patient. Might not be important to us. Might not be important to the doctor, whatever. My preceptor realized that. This is 20 years experience for her. So she's like, no. It's very important because, patients there sitting in bed. I mean, what else do they got to do? Watch TV and eat and heal. So, and that we poo-poo it, but nutrition's such a big part of the healing process, and comfort and all that. So pay attention to that. If the diet needs to be changed, need to be altered a little bit, tweaked, or just to be passed on to the next nurse, so they know, oh yeah, he or she can have that graham cracker or peanut butter, or no, they can't have it, or their NPO, what, et cetera, et cetera. They like their meds and applesauce, et cetera, stuff like that. Those are also little things that can be critical, or it could just be preferential, and that may make your shift easier. The easier your patient interacts with you, the easier your shift will be. I've had combative patients. I've had then to smooth them over, and I'm also on the neuro unit, so that I get that a lot, and I'm just used to it now. I've always been used to it. I've got combative family. So those are little tips. It's just a couple tips for the SBAR. Pay attention to what's keeping the patient there, and the diet. It's not the only tips. I'm just saying for this video, that's what I'm going to touch on, is diet and the reasons for staying. Okay.